Well, sickle cell disease is an inherited condition that, if left unmanaged, can lead to serious symptoms. But with proper care and treatment, people living with sickle cell disease can manage the condition and live long, healthy lives. To talk about that, joining us is Cone Health Chief Health Equity and Community Impact Officer, Dr. Olu Jegede. Dr. Jegede works with sickle cell patients at Cone Health Patient Care Center and is a member of the North Carolina Council on Sickle Cell Syndrome. So let's go ahead and start with the basics. For those who may not know, what is sickle cell disease and how does it affect people who have it?
Thank you for having me. Sickle cell disease is an inherited genetic blood disorder. So people are born with it. Instead of the normal round red blood cells, these people that live with sickle cell have red cells that are stiff and they are shaped like crescent. They are sticking together. They are very hard, and when they move in the blood flow, they can block the blood flow to some organs, and this causes pain. It causes infection. It may cause fatigue, and sometimes even life-threatening complications.
Yeah.
So the good thing is here at Cone Health, we provide consistent care and support for our patients. And with that, people can have even live longer and live a healthier life. Every day, we encourage our patients to stay connected to our care and making sure that they get what they need to stay as healthy as possible.
Absolutely. And how does someone know they have sickle cell?
Here in the United States, sickle cell is diagnosed at birth, so it's part of the newborn screening, and that is very important because if you know you have it early, then we can provide care early to prevent some of the complications. But for those who are not screened at birth, so maybe the immigrants that come to this country, the warning signs include severe fatigue, they may have frequent pain, and they may have delayed growth or repeated infections. And when they come in, it's a simple blood test that we can do to get them diagnosed.
What steps should people with sickle cell disease take to help manage symptoms and, of course, avoid complications?
So our team here at Cone Health create what we call individualized care plan for our patient, and this include what we call the disease-modifying medications like hydroxyurea. We also make sure they have access to the clinic here. We have a day infusion center where if you have pain without any other complications, we can care for you during the day. And also we provide vaccination update for our patients. We do their routine labs. But then for patients themselves, we educate them to avoid some triggers like dehydration, like extreme temperatures, like stress. And we work with our patients to address all the social barriers that could interfere with their care.
And when should someone with sickle cell contact their provider, especially when you're talking about those red flags to watch out for?
Oh, yeah, those red flags are really important and is part of the education to every patient. When you develop fever that is more than 101 degrees Fahrenheit, or you develop shortness of breath or chest pain, or even worsening fatigue or pain that won't go away, that is the time to call us. I mean, or even go to the emergency room because those are red flags. We work with to reduce delay in care. Like I said, we have the infusion center where they can come in and be treated for the whole day. That we have nurses that are trained in sickle cell. We have social workers that can work with our patients. We just want to get ahead of all the symptoms and save lives. So we encourage our patients, when you develop any of these red signs, red flags, please come to the clinic or call the day infusion center to be seen and to be cared for.
And we have about 45 seconds here. What role does hydration, rest, and nutrition play in preventing sickle cell disease?
Oh, those are key to the care of our patients. Drinking plenty of water definitely keeps the blood flowing, so those blockades are avoided. We say getting enough rest and good nutrition always help the body to recover and to prevent complications. Our care team here include all the people that can help with our patient to make sure they're staying hydrated. I call my patient most of the time and say, when you are even coming to the clinic, you still have to hold your bottle of water with you and drink plenty of water to keep that blood flowing.
Absolutely. Thank you so much. We're going to pause the conversation right here, and we'll be right back after the break.